She thought she was just tired. That's what she kept telling herself. Tired from work, tired from stress, tired from life. For 8 months, she ignored the fatigue, the occasional pain in her lower back, the feeling that something wasn't quite right. When she finally went to the doctor, not because of any dramatic symptom, but because her daughter forced her to, they found a tumor the size of a golf ball in her colon. Stage 3. It had been growing for years, silently, patiently, waiting. That story isn't rare, it's the rule. Cancer kills over 10 million people every year, and the most terrifying part isn't the disease itself, it's how long it can live inside you before you know it's there. Lung cancer, colorectal cancer, prostate cancer, breast cancer. Together, these 4 types account for over 1 million new diagnoses in the United States alone every single year. And the thing they all have in common, the thing nobody talks about enough, is that by the time most people find out, the cancer has already had years to establish itself. Today, we're going inside all 4, what they are, how they grow, what they feel like, or more accurately, what they don't feel like, and what you can do right now to catch them before they catch you. Stay with me, because the last section of this video might be the most important thing you watch all year. Let's start with the one that kills more people than any other cancer on the planet. Lung cancer, roughly 1.8 million deaths worldwide every year, more than colorectal, breast, and prostate combined. And the reason it's so lethal isn't just biology, it's timing. By the time most people are diagnosed, the cancer is already in stage 3 or 4, it has already spread. And that changes everything about what treatment can and cannot do. Here's why it hides so well. Your lungs are large organs, enormous really when you think about it, about the size of 2 footballs side by side. And unlike your skin, which you can see, or your stomach, which you can feel when something goes wrong, your lungs send almost no pain signals in the early stages of disease. The lung tissue itself has very few pain receptors, so a tumor can start growing, slowly, silently, in the periphery of the lung, and you feel nothing. You breathe, you go to work, you exercise, and the tumor grows. The symptoms that eventually appear are so generic that most people dismiss them for months. A cough that won't go away, not a dramatic blood-soaked cough, just a persistent low-grade cough that you blame on allergies or acid reflux or the dry weather. Slight breathlessness when you climb stairs, a hoarseness in your voice that comes and goes, fatigue, weight loss that you attribute to stress or dieting. These symptoms are so common, so easy to rationalize, that the average person waits 6 to 12 months before seeing a doctor after they first appear. And here's the part that should shake you. Smoking causes about 85% of lung cancer cases, but 15% of people who develop lung cancer have never smoked a single cigarette in their life. Radon gas, a colorless, odorless gas that seeps up from the ground and accumulates in homes, is the second leading cause of lung cancer in the United States. Air pollution, secondhand smoke, asbestos exposure, genetic predisposition. You don't have to smoke to be at risk, you just have to breathe. The biology of how lung cancer starts is worth understanding because it changes how you think about prevention. Most lung cancers begin in the cells lining the bronchi. These cells are constantly exposed to whatever you inhale. Over time, repeated exposure to carcinogens damages the DNA inside these cells, not once, not twice, but thousands of times. The cells develop mutations. Most of those mutations get repaired or the cell dies, but eventually a mutation survives. It replicates, it divides. And what started as one abnormal cell becomes a cluster, then a mass, then a tumor with its own blood supply and its own ambitions. That process takes years, sometimes a decade or more, and during the entire time, you feel fine. Now let's talk about colorectal cancer, because this is the one that is quietly becoming one of the most dangerous threats for people under 50, and almost nobody is talking about why. Colorectal cancer is cancer of the colon or the rectum, the final sections of the digestive tract. It's the second leading cause of cancer death in the United States, and it follows one of the most predictable, well-documented progressions of any cancer we know. It almost always starts as a polyp. A polyp is a small abnormal growth on the inner lining of the colon. Most polyps are harmless, but certain types have the potential to become cancerous over time. And that timeline is actually one of the most important facts in all of cancer biology. It takes on average 5 to 15 years for an adenomatous polyp to transform into colorectal cancer. 5 to 15 years. That is an enormous window, a window where if someone had simply looked inside your colon with a camera, they would have seen the polyp and removed it. The cancer would have never happened. That's why colorectal cancer is both one of the most preventable cancers and one of the deadliest, because most people avoid screening. The symptoms of early colorectal cancer, when symptoms exist at all, are infuriatingly vague: a change in bowel habits, constipation, diarrhea, or stools that are narrower than usual. Blood in the stool, but it's often microscopic, invisible to the naked eye. Abdominal cramping or discomfort, a persistent feeling that your bowel isn't fully emptying. Fatigue, unexplained weight loss. Every single one of these can be explained away as hemorrhoids, irritable bowel, a bad diet, stress, and most people do exactly that. Here is what's happening at the cellular level. The inner lining of your colon, the mucosa, is constantly renewing itself. Cells divide, old cells are shed. This rapid cell division necessary for the colon to function also makes it vulnerable. Every time a cell divides, there's a small chance of a copying error in the DNA. Most of the time, the body catches these errors, but certain genetic mutations, particularly in genes like APC, CRAS, and TP53, can disable the brakes. Cells start dividing when they shouldn't. They stop dying when they should. The polyp forms, and if it's never detected, over years those mutations accumulate and cancer begins to invade the deeper layers. The reason colorectal cancer is rising so dramatically in younger people, under 50, under 40, even under 30, is a question researchers are urgently trying to answer. The leading theories point to changes in the gut microbiome, driven by ultra-processed diets, sedentary lifestyles, antibiotic overuse, and obesity. The bacteria in your colon aren't just passive passengers. They actively influence inflammation, immune response, and even how your cells behave. When that microbiome is disrupted, the environment inside your colon becomes more permissive to cellular chaos. That's a conversation worth having with your doctor, because the standard screening age of 45 might not be early enough for you. Now, prostate cancer, the most commonly diagnosed cancer in men. The prostate is a small gland, roughly the size of a walnut, that sits just below the bladder in men. Its job is to produce fluid that nourishes and transports sperm. And like every other organ in the body, its cells can go rogue. Prostate cancer is unusual for one very specific reason. Its spectrum of aggression is wider than almost any other cancer. Some prostate cancers grow so slowly that a man can live with them for 20, 30 years and never have a symptom. Others are aggressive, fast-moving, and lethal within years. The challenge, and the source of enormous controversy, is that we can't always tell them apart early on. In the early stages, prostate cancer almost never causes symptoms. The first symptoms typically appear when the cancer has grown large enough to affect urinary function, difficulty starting, a weak stream, the feeling of incomplete emptying. Frequent urination, especially at night, blood in the urine or semen. By the time these symptoms appear, the cancer is usually well established. Now let's talk about the PSA test. The PSA test is a blood test that measures a protein produced by the prostate gland. Elevated PSA can indicate cancer, but it can also be elevated by a benign enlarged prostate, or by infection, by recent sexual activity, or by vigorous exercise. This lack of specificity has made PSA screening one of the most debated topics in oncology. Some men have been overtreated for cancers that would have never caused them harm. Others have had aggressive cancers missed because their PSA was not dramatically elevated. The conversation about PSA screening is not simple, but here's what is clear. Men over 50 should be having it with their doctor, and men with a family history or black men should start at 40. Black men have a significantly higher incidence and mortality rate from prostate cancer than any other demographic group. Starting that conversation at 40 is critical, not 50, not when symptoms appear. Part of it is biological, certain genetic variants. Part of it is systemic, barriers to healthcare access, quality of screening, historical mistrust. Both matter and both need to be addressed. Now let's talk about breast cancer. And this applies to more people than you think, because while it's overwhelmingly more common in women, men can develop breast cancer too. Breast cancer is the most commonly diagnosed cancer overall in the US. 1 in 8 women will develop invasive breast cancer in her lifetime. That is the woman sitting next to you. The breast is primarily made up of glandular tissue, fatty tissue, and a network of ducts. Most breast cancers begin in the cells lining these ducts, a type called ductal carcinoma. In the earliest stages, the cancer is confined. It hasn't crossed the basement membrane. It hasn't reached the bloodstream. In this stage, the survival rate approaches 99%. But cancer doesn't wait, and most early-stage breast cancer has no symptoms, no lump you can feel, no pain, no redness, no discharge, nothing. The lump that you can feel with your fingers, the one most people associate with breast cancer, often represents a tumor that is already a centimeter or more in diameter. It has been growing for years. What changes the outcome is mammography. A mammogram can detect tumors that are millimeters in size, years before they become palpable. This is the difference. The survival rate for breast cancer caught at stage 1 is over 99%. At stage 4, it falls below 30%. The difference is largely a matter of when it was found. And yet, mammography guidelines are confusing and vary by organization. Some say 40, some say 45. The confusion leads to delay, and delay costs lives. Here is what the most current evidence supports. If you are a woman with average risk, start mammograms at 40 and get them annually. No exceptions. If you have a family history, talk to your doctor about genetic testing for BRCA1 and BRCA2 mutations. If you carry those mutations, your lifetime risk is between 50 and 70%. Now, here is what ties all 4 of these cancers together. Every single one, lung, colorectal, prostate, breast, shares the same biological origin story: normal cells, accumulated mutations, disabled checkpoints, uncontrolled growth, and every single one of them is most survivable in its earliest stage before it has reached the lymph nodes or distant organs. The difference between stage 1 and stage 4 isn't just a number, it's the difference between a minor procedure and chemotherapy that ravages your entire body. It's a fight for time. So here is what you actually do. If you smoke, quit. That is not negotiable. Smoking is the single most preventable cause of cancer death in the world. Full stop. The risk of lung cancer drops significantly within 5 years of quitting and continues to drop over time. No supplement or lifestyle optimization comes close to simply stopping. Get screened. Colonoscopy starting at 45. Mammograms annually starting at 40. PSA discussion starting at 50 or 40 if you're a black man or have family history. And if you're a heavy smoker or former smoker over 50, ask specifically about low-dose CT screening for lung cancer. It saves lives, and most people who qualify have never been offered it. Know your family history. Cancer has a genetic component. Knowing that your father had colorectal cancer at 52 changes your timeline. Write it down. Tell your doctor. It is data that could save your life. Reduce what you can control. Diets high in red and processed meat increase colorectal risk. Obesity is a risk factor for at least 13 types. Alcohol increases breast cancer risk. Shifting the odds matters. And finally, do not wait for symptoms. That is the message of every single story in this video. The reason they survived is because someone looked before the cancer had finished building itself. Cancer doesn't announce itself, it operates in silence. And by the time you feel it, see it, or can't ignore it, you are no longer in the part of the story where the odds are in your favor. The screening exists, the tests exist, the window's open right now. Don't wait until it closes. Share this video with someone who needs it. See you in the next one.